What's going on? Welcome back to Jiu-Jitsu Outlet. I'm here with Gary Roberts, the host of the Good Dudes Grow podcast. You're also the founder of Promises Innovative Recovery, which is a psychedelic treatment center that I know you're working on opening down in South America. And before the show started, we were also talking about your martial arts background. You said that you've trained briefly in Jeet-Kune-Do, and I want to get into the plant medicines, and I want to talk about that, but I want to dwell on this a little bit. How did training in Jeet-Kune-Do prepare you for everything that you're doing now? Because for people who don't know, Jeet-Kune-Do is like early form MMA. It was like what Bruce Lee created as almost like an early form of MMA that he put together himself. And from what I understand, I've never trained in it, but it's very similar to whatever is happening in a modern day MMA school. So Gary, welcome to the show. And I just want to start off with that. How did Jeet-Kune-Do set you up for everything that you're doing right now?
Well, thanks, first of all, for having me on the show. It's great to be here with you, Paul. Jeet-Kune-Do, basically, like you said, it's an early foundation of martial arts. Basically, it taught everything from distances from kicking to getting into punching range distance to basically getting to grappling. So you started to learn all three disciplines and how they connected and how you can go from one to the other and just build upon your situation. And that's basically the same thing in life. You have to learn how to do the basics in the beginning. You start from, like I said, there's a distance. You start from a ground aspect of it, basically, of fundamentally being present. Because if you know where you are, especially in a fighting stance or MMA, you kind of know what's going to happen, what you're going to do, what your possibilities are, what's going to go on. And if you can actually arrange that in the order that you want, chances are there's going to be a pretty good outcome. You'll probably take some hits along the way, but as long as you're still progressing to that end goal that you see from the beginning, that you see the whole end result come, that's basically how it ended up. And that's basically how martial arts helped me about it. It was also the discipline. Don't get too excited, figure out where you are, figure out what's going on. And then, there's always a move or an action to counteract another action, which means that, there was never a problem. There was always a solution.
That's a great point, man. This concept of problem solving, I think, is what you're getting after here, where no matter what life throws at you, there's always a solution. There's always something that you can figure out. And I know that right now, man, you're wearing a lot of hats. Like one of your hats is a helmet because you're a firefighter. You're also you also, I know, have a CBD line of products that I use. I'm a big fan of the CBD that you produce, and you're also opening up this plant medicine treatment facility. So tell us about that. Like, how do you do this, man? Like, honestly, and also you have a podcast that I know you produce episodes very consistently. So how do you do all this, man? Like, tell us, like, do you have some secret sauce? Like what's the big secret here behind Gary Roberts?
Drive and determination, basically, and you learn, again, I'm going to go back to martial arts. You learn that in martial arts. It's you got to have that determination to get your end result. The cool thing about it is that, excuse me, everything that I'm doing, it built the foundation for my place in Costa Rica. So, it started out becoming a passion of mine when I lost my daughter from an opiate overdose and trying to figure out how to revamp the addiction process with plant-based medicine like CBD and cannabis. And that led me down the road of trying to help more and more firefighters with mental health, suicide, pain relief, and not to be so addicted, or how they would actually basically get off the prescription medications, instead of actually, because we all know prescription medications, you take one, then there's a side effects, you got to take another, then you take another, then you take another. And, you go down this road of complete, what pill's now working for what, we have no idea anymore. Because where plant-based medicine is basically, there's no side effects, so you can actually figure out what you need to do. And that's how Costa Rica came about. To be honest, we found that there was a need, how to teach the patients how to use plant-based medicine, because as we all understand, plant-based medicine has a huge stigma. So, that's where the podcast was created to destigmatize that. But trying to teach patients what it's good for, you're battling an uphill battle, because the first thing they'll say is, "Hey, listen, I'm going to go talk to my doctor." Well, what does the doctor say? "Oh, there's no medical proof on this. Don't believe that stuff." So you're trying to educate the patient, then now you're going to have to try to educate the physicians. Well, physicians won't be, I'm not going to say they won't be educated. They'll listen, but unless it comes from their physician association or a higher up, they're not going to take it from their patient and then start believing in it. They have to find some sort of reason or medical data or clinical data that proves this aspect of it. So he says, okay, we need to try and create something like that. But we couldn't create that in the United States because with all the red tape, cannabis still being a Schedule 1, psychedelics still being a Schedule 1, the DEA gets involved. There's red tape. There's hundreds of millions of dollars to do it. We're like, well, this is fundamentally going to be impossible. So we decided, why don't we look at what's going on around the world in retreat kind of organizations, because we heard a lot of retreats are doing special things with ayahuasca and stuff. They're not using psychedelics per se as like LSD and MDMA or psilocybin, because those are still illegal in several of the countries. Some of them are starting to get legalized, but they're using stuff like ayahuasca. So we looked into that avenue, and what we found was there was an issue with that type of treatment, because the last thing you wanted to do is get somebody who doesn't understand how to use ayahuasca, send them to an ayahuasca treatment where you're being shown by, and I have all the respect for the shamans and everything else, but on a medical aspect of it, they're treating the same patients in a group that have all different types of medical conditions. And it's really hard to do that, and the outcome may not be good. So he says, so what would be the best way to fix that? We says, well, let's create a facility that has two entities to it: a hospital setting, which basically is the staff is fully medical, and incorporate the spiritual aspect of the ayahuasca retreats and combine them and create a full resort that has medically trained professionals on staff, but it has a disguise of a resort. Because one of the biggest things when you go through these medications, you want to be in a relaxed state, someplace comfortable, someplace you feel safe. Where does everybody go to relax? They all go on vacation. So why don't we just make it look like a 5-star resort, but have it fully organized, fully run by a fully medical staff, where we can actually make sure that you have the treatment you want for the condition you want. And one of the cool things about it is we're not going to treat everybody the same. We're working with organizations that we're able to do precision medicine. Basically, we're doing genomics or DNA testing to find out exactly what cannabis or THC can do for you. Exactly the same thing for psychedelics. So if you think that all of a sudden you want to, because you heard on the news, do a psilocybin trip, we talk with you for a couple of weeks prior. We do some genomic testing, some DNA testing. We find out that it may not be the best compound for you, and we might push you towards a MDMA or a 5-DMT or something like that. So we're basically treating the patient with the condition, not just organizing big fundamental trips.
Thanks so much for sharing everything, man. And I think there's so much passion in your voice when you're talking about this. Like, you're obviously just so excited. And we've done podcasts about this before, and I just wanted to say again, like, thank you, man, for doing this, because you're really a patriot on the front lines of all of this stuff. And I really just wanted to say thank you, like, on behalf of everyone who's ever gotten benefits out of psychedelics. Like, we need more people like you who are doing this work. And I know it's only because you're so motivated to help your community and help people like you who had experiences with children who maybe passed away from opioid addiction and stuff like that. And man, you're doing it. You know what I'm saying? Like, it's manifesting this goal. And I'm so excited to one day come to this resort and have an experience, or, if it's appropriate. And I just think the way that you're handling it is so good, man. And I want to dwell a little bit more on what you said at your centers, and just if even outside of center, like, if someone were to use psychedelics, what sort of harm reduction measures could they use, or should they be using to have an experience? And what of these measures are you guys going to be implementing at your facility?
Well, right now there's basically two thoughts. There's a thought of the people saying, you know what, just take the substance and wheel and deal it with how it comes, basically learn how to deal with it and, figure it out for yourself kind of way. That's one, realm that's out there. And a lot of that is basically the people who are actually pushing for the decriminalization so that everybody can start having, these trips, thinking that it's actually the medication that's going to do them the right or the best thing for their case. When in reality, we're finding out more and more now through research that the medication helps, but it's only a piece of the protocol. So what we're doing is we're basically doing a pre-integration process where in 4 weeks you're going to actually talk with a psychotherapist so he knows exactly what you want out of it. Because there's a lot of people who read these newspaper articles, read these things, listen to podcasts, and go, you know what, psychedelics is the thing that's going to help me. It's going to change my life. When in fact, it may not be. They may just need to talk to somebody in the beginning. So that's one safety thing that we're doing. We're trying to see if who's coming to our facility is actually really in need to be there and not just going because it's the new trendy thing to do. And by doing that, we get a lot more medical information. We get a lot more background, and it helps us to actually tailor that journey or tailor that patient's access using those compounds to what they want so that they get a better benefit on the outside at the end of their trip. And at the end of their trip, we follow up. Basically, we're trying to keep it in a community to where we're always going to have access to these patients if they want us. If they want to actually get the results from their week stay with us to go to their psychotherapist they're seeing on the outside, we can provide that so that the therapist on the outside now knows what the patient went through during psychedelic therapy, is able to continue that post integration afterwards and continue those conversations so that it gets there. One of the people told me basically using psychedelic medicine with the post and the pre and post integration, it's kind of like having a roadmap, kind of like taking a trip around the world that you don't know where you're going, but yet there's a roadmap and you have this special guide there. Well, that's what psychedelics do. It opens your mind to the path, but there's a lot of work afterwards to get better so that you stay better. Otherwise, what ends up happening is people just reoccurring, trying to figure it out, just keep going back and going back and going back. When in a lot of times you don't need to go back. A lot of studies show, 1 or 2 times a year, and as long as your integrations are set, you're doing good. You're doing awesome.
Yeah, just to speak a bit, like anecdotally, I would never personally make a recommendation about this stuff because I'm not a medically trained professional. I would refer them to someone on your team. But my experience is I was using the Talkspace therapy app, which is a great service that I've talked about on this podcast before. And you can actually, if you're listening, you can find a link to Talkspace down below if you want to sign up. Great service, but basically you can chat with a therapist like over text, or you can do voice recording, and they have certain levels of subscription where they have certain levels of like availability basically, but you can record. I was on the subscription plan where I could record like unlimited voice messages with my therapist, and then she would like get back to me at her availability sort of thing. But I was free to send as much as I wanted basically. So I would have an experience, just at my house, in the quiet of my room by myself, maybe with a trip sitter or some sober friend in the other room. And I would be, having my experience, and then I would record voice messages to my therapist, or I would text stuff to her. And then afterwards we would integrate the experience, and we would talk about it for like, a month or 2 or 3 or even in years in some cases. And, that I got extreme benefit out of that. But I don't think either, personally, just again, my own experience, I don't think either one would have been as effective without the other. I don't think I would have I think if I hadn't had the therapist, the psychedelics would have just been me escaping and just me like trying to almost like go in blindly. But without the psychedelics, I don't think I would have been able to, I 100% would not have been able to realize the things that I realized during that time. And one of them was, that I'm on the autism spectrum. That was like a big part of this. And then she ended up being able to help me get diagnosed with that, which has helped me a lot in life, with just kind of understanding myself. So that was my experience. Just wanted to share that, but it totally goes in line with what you're doing, because what would have been better is if my therapist could have just been there in the room. But because of the ways the laws are set up and because no such center existed, because this was years ago, you know what I'm saying? Like I had to jerry rig it, basically, as they say, or as they say out here in the Ozarks, Mickey Mouse out here. So I Mickey Mouse the treatment center in my bathtub, basically. But it worked, it worked for me. So I think it would have been way more effective though, if I had done it with what you're doing, man. And obviously a lot safer too. That's the thing. The laws as they're set up now, it increases harm because there's a lot of people doing what I just described. Like I'm not the first person to come up with that idea by any means, but that means from my perspective, there's a lot of people who are not doing it right. So yeah, I guess like, what do you have to say about that kind of stuff? Like, do you want to see more availability, where it is more available for people? Or do you think that we still need to have a certain amount of restriction in place? Like, what's your view on that?
I think it can be decriminalized. There to have the ability to do microdosing, and there should be like they're doing now with the medical cannabis, where there's a certain amount you can have. This way you don't get caught and stuff. Microdosing, you're not going to be out in space and stuff like that. It's just a kind of like a natural thing that can do to help you calm down and help everything else. But for these events that you're actually trying to do for PTSD or traumatic brain injuries or stuff like that, you're going through that big trip. You want that out of body experience. And just like you said, and this goes back to what you were saying before about martial arts and what we talked about, where, you're thinking of your end goal. So you're thinking of the moves you need to do through it. That's what the pre-integration to psychedelics does. You just don't want to go in and say, well, let's see what's going on with me. You want it to be specifically tailored to an issue that you think you're having. Either you're having angry issues, or you're having nightmares, or you're having these issues. So you want to dive into that, and you want to have it be dealt for that purpose. So having those, like you said, your therapist there, or that integration, what he knows what's going on and why you're going to go there, it's a bigger benefit to you than just trying to guess. And some of the stuff that's going on, you got to remember that if you have a tendency or a biomarker for schizophrenia, psychedelics is not the thing you're going to go to. And a lot of people, what they do is they don't, they may not know they have that biomarker. They may not have been tested to see if they have that genetic disposition for schizophrenia. Well, psychedelics will enhance that. And that's something that you don't want to go. And like you said, we don't want to advise people, hey, listen, go do this. The last thing I want to do is advise a fellow firefighter who's on the verge of committing suicide. Yeah, go try it without some sort of pre-integration, medical oversight, post-integration, because then you're sending him down a road where maybe he may commit suicide. And next thing you know, you have that on your back. So that's not something you want to do. One of the cool things I want to let you know about our site, when you said it'd be cool to have your therapist there, our facility is also going to be a training facility for therapists and physicians. So they're going to be able to come and see these treatments being done, so that when they get back to the United States and people come out to our facility or go to other facilities to get these treatments, they know what the patient has gone through. And by knowing that, their therapy is actually going to be more enhanced with that patient, having that knowledge of what this type of therapies and psychedelics can do. And the cool thing is, we're not just doing psychedelic therapy. We're just not doing cannabis therapy. We're actually have the opportunity to do therapy without medications, like low-end dosing. For example, you get a firefighter couple. Listen, one of the biggest things in firefighters is that divorce rates are really high. So if you go do psychedelics or something else, you're going to come back a little changed. Well, you don't want to come back changed to your spouse, because your spouse always having an issue. It may cause a bigger dilemma. So we have a program that you can bring your spouse with you and do low dose, maybe GMB type style, or even breath work or NLP or even EMDR therapy with your spouse while he goes through psychedelic therapy, so that you both understand what the treatment's been going through. You both understand what he went through. You're understanding what he's trying to deal with and how he comes out at the end. And therefore, that support system is now integrated at home. So now you have both the female and male, basically, who have been married, who went through these sessions together. The outcome is 100% better.
That's amazing. That's such a good idea, Gary. And you're right. There's so many people, and I love what you said earlier too, that there's so many people that maybe just need to go through a few months of therapy. They don't actually need any sort of medication or any sort of psychedelic or plant or anything. They might just need some breath work, or they might just need a yoga practice or to talk to a therapist for a minute. So let's transition into that. And just as we gotta start wrapping this up here. Zoom's gonna kick us off here pretty soon. But I want to kind of talk about the lower end of the spectrum. Like, let's talk about CBD. I know that you have some CBD products. I've used them many times, and it's the best CBD I've ever used, hands down. So I want to talk about CBD, and let's talk about CBD and martial artists. How do you think a martial artist could benefit from using CBD every day?
Well, CBD is a natural anti-inflammatory, so, martial artists, sports figures, whoever does sports and stuff, inflammation is the name of the game for us. Lowering inflammation means better workouts. Better workouts means faster progress. Faster progress means we get to the goal we want to get to. So that's the cool thing. One of the coolest things about CBD, it's also used for HDHD, for actually focus. So like I said in the beginning, for types of style of martial arts like Jiu-Jitsu or Jeet-Kune-Do, where, like I says, you're planning moves against somebody to actually counteract somebody. So you need to get into that zone. Everybody talks about that zone where the body just kind of flows and you understand what's happening. Well, CBD actually helps that. You actually get more concentrated on what you're doing. So if you can be more concentrated during your martial arts and stuff like that, then you're able to actually perform better. That goes for competitions. When I used to do a lot of CrossFit competitions, I used to take the CBD before doing a competition because it would relax me. Anxiety pre-competition is ridiculous. So it actually calms you down. It lets you focus, and mentally you're in what you're doing, in your groove, in your zone. So it mentally puts you there before even starting at a nice calm rate. So it's something that athletes really can use 100% for everything from training to actually competitions.
My wife had a question for you. So again, we're big fans of your products here at our family. Can you describe the difference? Because I know that you have a couple different types of products that you sell. Can you describe the difference between CBD, CBG, and CBN?
CBD basically is the one that came out first. Basically, it's an anti-inflammatory. It's an isolate of the plant. Basically, that's one molecule. So that's basically works in the CB2 receptors, which actually works for the inflammation throughout the body, for the joints and everything else. So that's the quick thing for that. CBG is basically what we call the Rolls Royce of CBD. Basically, it's a higher analgesic, higher inflammation, and higher anxiety product. So basically, you add that to actually get a better analgesic, better inflammation, and it really works really well on anxiety, really calms you down. So if you get a mixture of a CBD, CBG product, that'll actually almost double your effects that you actually need. CBN is the cannabinoid that actually helps with rest and sleep. It's one of those molecules that helps you really relaxed and really go to sleep, and you have a nice long REM sleep. So those are the three differences. So if you're looking for a sleep product, you're looking for a CBN product. If you're looking for a high inflammatory and anxiety product, I would recommend a CBD, CBG product. If you're just looking for some little, like, I would call it, I hate to use the word, but kind of like an Advil or Tylenol, you just go with a CBD isolate. But me personally, I love the CBD, CBG. It works for me for sleep, inflammation, everything. That's my go-to product.
Can we talk a little bit about Delta 8 too? Because I know that that's super hot right now. I know that you've got some Delta 8 products on your store. I've tried them before. Your gummies are super delicious, man. Can we talk about that? Like, what's the difference between the Delta 8 THC and the kind of THC that you would need like a medical marijuana card to get?
Well, the Delta 8 THC, basically, it's the legal form of hemp. It's basically underneath the hemp farm bill because it's derived from hemp. I call it the Delta 9's baby sister, which is actually the illegal THC. So what they do is they synthesize the hemp to actually create a not as high psychoactive product as a Delta 9. It still has some Delta 9 in it, but it's not full-blown psychoactive as a Delta 9. That's why I call it its baby sister. But you could get a good buzz on it. It's just not going to really make you so much so paranoid as the Delta 9 would be, because the Delta 9 is a stronger product. And even stronger than that, they're coming out with this stuff called Delta 10, which is also derived from the hemp, but that's kind of like trying to outbeat the Delta 9 kind of thing. They're just trying to do some things to create more sales and stuff. But the Delta 8 I use for my old people. My old people love it. The seniors love it because they're on a lot of pain meds, and they take the Delta 8 and it lets them sleep.
That's one of the things that I've heard a lot, man, just kind of throughout this conversation is the benefits of sleep, and just you saying that these help sleep rather. And I know, man, sleep, like if you're sleeping well, that'll help just a plethora of other activities, man. Yeah, hey, if you're listening to this, I'm going to put a link down to Gary's products down below. And I'll say this too, I'm a medical marijuana user as well. And most CBD products, I don't even feel anything because I'm so used to smoking THC, because I use that too, because it helps with the autism basically. And I love CBD for other benefits, but honestly, man, yours is like the only CBD that I actually notice anything, because I have a really high tolerance. So if you're listening to this and you're also a medical THC user, and you usually don't like CBD, Gary's products actually work. I can vouch for that. I have tested it, tested and verified. But Gary, we got to wrap this up. Zoom's going to kick us off. But before that, is there anything else you want to say, man, or anything else that you want to talk about related to plant medicine and just, everything you're trying to do?
Hey, quick tip for all those who are drinking THC, like high dose THCs, and they think it's helping, but they get too stoned. Buy a high dose CBD product, isolate. It'll actually cut down effects, so you won't get stoned right as high and as strong. So if you're having a bad buzz, throw down some CBD isolate. It'll take the buzz away a little bit from you. It'll probably take about a couple of minutes, 20 minutes, 40 minutes from it. Take it from you. But before we get cut off, I want everybody to go to my website, promisesinnovativerecovery.com. If you want to help firefighters, veterans, and anybody who's suffering from PTSD or brain trauma, there's a link on there that you can donate. All 100% of the donations go to the facility to actually help build the facility. That's our nonprofit. You can write it off at the end of the year. So we would greatly appreciate your help getting the project off the ground.
Gary, you're the man. I appreciate you. And hey, if you're listening to this, I'm going to throw all the links down below to what Gary is doing. So go to the links that are down there and use your finger to click the buttons and read the things that are on those pages. But Gary, thank you so much. And also, I know we didn't get a chance to talk about this too much. We do have a moment. If you do, can you tell us a little bit about your podcast? Like, what have been some of the big things that you've been talking with people on the Good Dudes Grow podcast? If you have time, if you got to go, no worries.
Yeah, the Good Dudes Grow podcast was basically, I was a firefighter. I got all the doors slammed in my face saying, we're never going to touch the stuff. We're never going to touch the products. So I said, the only way to do it is actually bring people to the front and to ask them tell their experiences. I have NHL Stanley Cup professionals on there, NFL superstars. I have top entrepreneurs, CEOs, doctors, physicians, anybody that wants to talk about what cannabis has done for them in the past and how it's helped them overcome either brain trauma or basically opiate overdoses on there. I have Tommy Chong from Cheech and Chong on there. He's been one of my guests. It was built as an informational platform. And since I've built that, right now, the fire department basically has created a health and wellness committee for cannabis and psychedelics. And I'm now that chairman, and we're in the process of trying to get our firefighters access to it here in South Florida. So it's a platform, educational, reach out, whatever you want to do. We're here for education purposes.
Gary, that's awesome, man. I remember when you first started that, and it's amazing to see like what you've achieved with it. And you're just getting started, man. Like you're just 2 or 3 years into the project.
I was a complete disaster at the beginning, had no direction of what's going on. And ever since then, everything everything's coming into place. So everything's coming into play. You know, it's guys like you and podcasts that help me get on and get the word out, and everybody who actually with their donations, everything that's been helping tremendously. So without people like you and everybody else supporting us, you know, this facility would not be as close to being open as it is now.
Gary, that's awesome, man. I'm excited. I'm excited to come down there and check it out.
Definitely.
But thank you, man, for coming on the show. Much love. And we'll have you on when we'll have you on again when the center opens, and we can promote that and tell people
we'll
where
have you out at the center. We can do a show at the center. How about that? We'll do a live show from the center. That was the way we could all talk.
That sounds great, man. Now we're talking. All right, man. I appreciate you.
Appreciate it, Paul.